Good afternoon and welcome everybody. Welcome to CharmHealth's Wednesday webinar series. Today's webinar is on the top 3 features to grow your practice with Fullscript and CharmHealth. Thank you for taking the time to be here today. My name is Ranjani Rangan. I am a marketing and customer experience executive here at CharmHealth. I enjoy telling compelling stories about the CharmHealth brand and how our CharmHealth customers have grown with us. You may have met me at our exceptional CharmLad event, which is our annual training and customer appreciation gala. If you haven't, please join us in the future years, especially when COVID has relaxed itself. So I'm excited to be joined by our longtime CharmHealth partner from Fullscript, Hala Al-Hafez. Hala has been working at Fullscript for 7 years, and during her time, she's gained valuable experience onboarding and setting up practitioners for success on the platform. With her extensive knowledge of Fullscript, she transitioned into the Fullscript integration team. Now she works with all Fullscript partners to launch, optimize, train, educate on EHR integrations with Fullscript.
Thank you, Randy. Thanks for having me.
Yeah, well, wonderful having you too, Hala. And how are you this afternoon?
I'm great. I'm great. I'm here in Ottawa, Ontario, and it's getting quite chilly. We got our first snowfall a couple of days ago.
Yeah, I'm actually not even cold, and I'm wearing this sweater. So it is pretty warm here in Arizona. So yeah, the snowfall is very beautiful. Well, great to have you here.
Thank you.
Just really quickly about Fullscript. For those of you who aren't familiar with Fullscript, it is an online dispensary that gives you access to thousands of professional-grade supplements to recommend to patients without carrying inventory. In addition to earning revenue from supplement sales and refills, many practices are able to reduce their overhead and provide clients with a convenient venue to get their supplements. As Hala will mention, we've seen case study after case study that shows that practices are really able to grow by using the Fullscript integration within CharmHealth and over directly using Fullscript. Over the next 15 or 18 minutes or so, I will be introducing 3 relatively new or enhanced Charm features. Immediately after, Hala will be sharing 3 newly released Fullscript features, which have been chosen to be some of the best practices to streamline, optimize, and grow your practice. All right, so we are all here because you wanted to start your own practice. And one of the primary goals of Charm is to help with expanding and scaling your practice. And I wanted to start off by saying that Charm is really set up for your growth. And that may be why many of you were attracted to come to Charm. And starting from the various pricing tiers, from it being free under 50 encounters, or our pay-per-use model, or our fixed price model, the pricing structure is really set up to help take the anxiety out of growing or expanding your practice. And this is really what I hear from customers over and over again. They love Charm for that one-stop integrated solution, an EHR that's highly intuitive user interface that enables you to run a more streamlined, productive medical practice, all with that affordable pricing. And Charm is set up for seamless expansion, whether you are a small or a multi-specialty or multi-facility, medium or large practice. But really practices, what you should really know is, this is something that has evolved with Charm over the last few years, is that Charm is much bigger than just an EHR. And it's just one part of the picture. And it's really an ecosystem. And you are part of that ecosystem. So at the start of 2020, during the COVID pandemic, many of our clients suddenly found themselves in need of technology that could not only handle their patient records, prescriptions, coordinated bookings, but also one that can integrate telemedicine or connect to apps, wearables, remote monitoring devices, virtual chatbots, or automate billing, or engage and educate patients remotely. And while we started as an EHR, over time and accelerated by the COVID pandemic, Charm has evolved into an ecosystem of solutions to provide a robust marketplace with extensive API and where you can connect with devices, external devices and platforms like Salesforce CRM to help move your practice towards a more value-based care model. The Charm mission is essentially to empower, is several, but essentially it's to empower you, our practices, and help you scale to meet to meet your specific growth need. And let's look at your care delivery flow. It can be really divided into 3 parts: before your visit, during, and afterwards. And let me ask you a few questions. Are you and your staff repeating steps in your daily workflows that could be eliminated or streamlined? Just take a moment to think about these questions. Does your practice have communication issues with patients or maybe each other? Could it be improved? Are your intake and scheduling processes done manually, so it takes more time than needed to complete for each patient? We will look at patient reminders, the bolded areas right here, patient reminders and scheduling, patient intake, the before the visit processes, and in the care coordination area, we will look at one of the Charm features that will help you in that. These new or newly enhanced features in Charm will help better streamline your practice. So there are the 3 features in just to go into it, or an SMS-based automated appointment booking assistant, a configurable pre-appointment questionnaires with auto-send, and a communication platform for your care collaboration, which we call CharmConnect. And I just love the word auto, and you're going to see a lot of that coming up. It just takes the practice admin, office staff, physician out of the picture. Just making sure you guys are all paying attention. So let's get into the automated appointment booking assistant. This is a booking tool to automate repetitive, mundane scheduling. So the automated booking assistant is available for practices in the US and Canada, and it's pretty self-explanatory. It's an SMS-based automated assistant. A patient can respond to these automated reminders and cancel, confirm, reschedule future appointments. Also, instead of your staff shifting through mindless paperwork, the booking assistant can autofill those canceled slots with waitlisted patients, and I just love this feature. The booking assistant will help reschedule those missed appointments, and in addition to all this, you can have a view of the communication history, have an electronic record of the communication between the practice and the patient about the appointment. We'll see a screenshot of the communication log of what that may look like shortly. So the images, I think I know why. Here's a view. I have that on click and it'll show up. Okay, like what happened? Here is a view on how a typical SMS reminder would look. In this case, this is a message to the patient to either confirm, cancel, or reschedule. There are several other messages, and many of these can be customized to some degree, and they're pretty self-explanatory and very simple for the patient to use. By the way, just for your information, I hope all of you have subscribed to our YouTube channel. There are great tutorials on how to set these things up, and they're pretty simple. And of course, there are many resources that Charm has. Aside from our support staff, you also have a lot of online resources, and I'll send you those links afterwards. Please take advantage of those. So what are the benefits to your practice? Many practices lose revenue by missed appointments, no-shows, and late cancellations. And if patients are better informed and reminded of these appointment types, practices have a better chance of retaining revenue and fulfilling appointment times. So reduce those no-shows with automated personalized reminders. And your staff can be freed from manually filling the slots by calling each. They can be freed from having to do the manual filling of the slots by having to call them. So the automated assistant will do that. It's going to reduce your administrative work and the call load of the front desk thereby. You can increase patient satisfaction using the automated waiting lists. And some patients, you can even be able to see more patients and quickly fill those openings. Manage all those records electronically and reduce the manual effort of administrative work and documentation. Overall, the process of using automated booking assistant saves your costs, and it's just cool and streamlined.
Right. And I feel like more so patients are just more reliant on their phone than, let's say, email. So I feel like I always respond back to any of my confirmed appointments via text 100% than when I get an email. So it's just more dynamic and just more immediate.
Absolutely, Hella. And we're also finding just after COVID, people are just relying on their devices or just using some sort of technology to communicate in many different ways, be it SMS or telehealth or, and we'll get into it later on, like the CharmConnect app, a messenger app. Very quickly, here is a log of exchange messages between you and your patient. That is the automated booking assistant and your patient. The appointment scheduling removes essentially, to sum this up, the appointment scheduling apps removes that manual, repetitive work associated with managing schedules and lets you focus on growing your business. Just so you know, this is included in all 3 tiers of the free plan, and we've seen like 85% of our practices who have used this see an improvement in their efficiency. The cost of this feature is really the use of the SMS text feature, which is an add-on service. And as a side note, the SMS feature and the bulk messaging features in Charm is a super great feature and a great add-on for just engaging your patients. Okay, moving right along to pre-appointment questionnaires, a smarter, more efficient way to manage patient encounters. One of the biggest challenges of using an EHR is how to fill it up with the patient data. And this is where your questionnaires come into the picture. What if you could create custom intake forms for your patients to complete online before their appointment with the demographics, health, insurance information, and more? And how about if the form data was automatically pulled into the patient's chart for review by the doctor before and during the visit? And again, the key word here is automatically. And what would it look like if a physician could save on upfront paperwork and thereby increase the physician's availability for patient care? So what is it? Patient, essentially, with the patient being the most, with the patient being the person most interested in providing a thorough history, it just makes sense. It allows the patient to enter and submit their health history, medication, insurance information, all prior to the appointment. And what's new is that widgets have been now added. This feature has been there before, but new widgets have been added to make the patient process easier on the physician. And they've been constructed to help improve patient engagement. And we'll see what that is shortly. And these questions can be auto-shared, and we'll also see what that means as well. The widgets that have been added will be used to collect the patient history, and they'll auto-populate whatever the patient fills will auto-populate straight into the chart notes. And this eliminates the time spent by the providers in manually copying the data from the questionnaires to the chart notes. So here's the typical pre-appointment questionnaire workflow. Patient schedules an appointment. The physician shares the pre-appointment questionnaires. There are 2 options to do this. You could either manually share it or auto-share it. Now, the manual share is what we've been doing. The auto-share is when the patient schedules that appointment, the physician can actually have pre-configured it such that the EHR, pre-configured it such that the questionnaire gets shared via email the moment the patient makes the appointment or at a set time. It removes that possibility of error and the manual effort of sending the questionnaire.
Saves so much time.
Yep, it is a huge plus, and a lot of our providers have loved this feature. The patients then fill up these forms from their Charm PHR account, and the patient history auto-populates into the chart notes based on that widget.
Wow.
So let's look at some of those widgets. that are available. Initially we had patient history, insurance details, demographics, allergies, medications, and supplements. Now we have added chief complaints, symptoms, the history of the present illness, past medical history, family history, social history, and the review of systems. And this is what it would look like within the UI. And very, very simple, fairly simple to create that questionnaire. And when it gets pushed into the chart notes, you will have a reconcile button that once the questionnaire has been submitted, you can then reconcile you can press the reconcile button, which will then push it into the chart notes. Mm-hmm. So, what are the benefits to my practice? There are a lot of benefits. Patients can share their personal information better. You can imagine a psychiatric situation or maybe gynecology patients. Maybe there's something more private and they don't want to, necessarily express it, and they can do their histories easily at home. And enabling the patient to share the data makes the time spent in the encounter more efficient and really enhances that fluid communication. Both the doctor and the patient are focused on the health concerns presented at the start of the encounter. So going through this, a physician can focus on the patient's concerns. The patient can share more detail and data. And this is true and sometimes overlooked. Patients are just better organized during the visit. And office visit is better streamlined. Patients are satisfied because they're more engaged. And the patient entered history can enable an unhurried assessment and a plan.
I find that this allows you as a provider to be very much prepared without much surprises there. And yeah, as you mentioned, just very efficient with your visit. You've done the history and some of the questionnaires, and now it's time to discuss an action plan.
Yeah, absolutely. It's the benefits cannot be understated. Definitely overstated. So let's move on to our last and final feature, CharmConnect. And this is a better, faster, and secure way to communicate. And this is becoming more and more important as we move into that era of value-based care. It's about creating a better health experience for you and your patients. So CharmConnect. CharmConnect is a HIPAA-compliant, secure instant messaging chat platform. It is integrated within the Charm EHR workflow and allows you to seamlessly interact and collaborate with your patients and practice members, and really without moving out of Charm. The Connect platform is integrated within the Charm EHR workflow, so you can communicate contextually regarding lab results or regarding a particular patient, and really whatever regarding an encounter. And all this is within Charm instead of a standalone messaging platform. It's this, and then along with this comes the CharmConnect mobile app, which doesn't require a separate login. So providers will use the CharmConnect app. And well, we'll get on to more. So here's an example of what it could look like within the app to share a chest x-ray, for example. Oops. So what are the benefits of CharmConnect? So often what happens is a patient tries to reach the doctor and the doctor needs to return, he's busy, and there ends up being this problem of telephone tag. So it results in this delayed communication and sometimes even miscommunication, which can affect your practice. Moreover, you can address routine health issues that are just pretty, routine, and you can handle these more efficiently, freeing up time for additional office visits and increasing access to patients who need to be seen. Additionally, you can capture and document communication with patients within the EHR and improve that recording accuracy. And what's more is that your staff can triage these patient messages and batch these answers. So maybe not everything needs to be answered by the provider, or maybe the practice admin can be freed up and the staff could answer it. This really improves your efficiency and saves time, and you can even put together some auto replies for those standardized questions. So this is an add-on feature, and it's available in all tiers. It's $2 per provider for the communication platform. And if you just want to try CharmConnect and see how it works, it is free to try for the first month. And the advantages to the patients are essentially the secure messaging provides an easy way for patients to communicate with their providers between visits. And they're in an unpressured setting that really fits their schedule. And sometimes it's just frustrating for patients when they're trying to reach their providers by phone and they have this easier access directly to their providers. Patients feel more comfortable discussing those sensitive health issues, and they're using secure messaging rather than in person. Mm-hmm. Patients can follow up with questions they may have forgotten. I know that happens to me a lot, and they wouldn't have had time to ask them during the clinic visit. They can also review their provider's responses whenever they have time. Patients can share important information for managing their health conditions such as blood pressure or blood glucose levels, or follow up with questions they may have forgotten. Sometimes, providers have questions about using these messaging platforms. And these are very understandable. There's a worry that they'll be swamped with questions, or they're not going to get paid to answer all these incoming, messages, or perhaps patients won't want to use this new messaging service. But studies have shown that the call volume actually decreases when secure messaging is introduced, and providers actually appreciate being able to respond to their patients at convenience. And the time spent with communicating through secure messaging often replaces that time spent on less efficient telephone calls. And with patients not feeling secure about secure messaging, they understand the value of secure messaging when they are able to reach their provider more easily, so they'll be more likely to try it. And again, after COVID, study after study showing that patients are wanting to be able to directly communicate with their doctors. So, as I said, studies have been done, and so this is a quote that is from Wakefield in his study, and he says that rather than being inundated with messages, providers actually experience increased productivity, or according to a number of evaluations. With this, this will be the end of my part of the presentation, the top 3 features of growing your practice. I hope that was clear, and I hope you enjoyed it. Thank you so much for listening and being part of my presentation. If you are interested in this Charm demo or want to see some of the Fullscript features, we can do a breakout at the end of this webinar. Please continue to ask your questions in the Q&A section. Thank you so much, and I'm going to now hand it over to Hala. And I'm going to go ahead and stop my share, Hala, so you can go ahead and take it over.
Thank you so much, Ranjani. I'm very excited to showcase some of the tools I've prepared for our attendees today. I kind of want to preface by saying that a lot of the Charm tools that we saw today are really dedicated for that, one-on-one communication from what I saw from Ranjani's presentation. And I would say one-on-one communication and obviously this one-on-one treatment approach with your patients is definitely always the way to go. It should be the bread and butter of your practice. And the Fullscript Charm integration works to streamline that very workflow. So within your one-on-one communications, after you receive the intake forms, after you recognize a patient's, supplement history. Should you want to add further supplements to their encounter and to their future visits, you are able to do that from within the Charm Fullscript integration. Now, of course, we're not going to go in depth into the integration, but if we wanted to after with a breakout room, we can. Today, what I'm going to go over is some of these complementary tools to your one-on-one care. They're meant to complement your workflow within the Charm Fullscript integration. They're meant to be add-ons to what it is that you currently do and work with patients on. And the theme for myself is really to kind of elevate your practice, grow your business, maybe understand more your business goals and how you can reach them towards the end of the year. So that's really my theme for today. I will go over more many-to-one approach versus that one-to-one. The agenda of the three main tools that I'll be going over, the shareable wellness protocols. These are a relatively new or enhanced protocols on Fullscript. They're meant to allow you to batch send or generate a link to a protocol that you can then send out to your patients and can then communicate via your public channels about them. Your Adherence Insight Dashboard, this tool, again, very new to Fullscript and already being worked on and being improved. The main essence of it is providers such as yourself are looking for more metrics and details on who's ordering and who's not adhering to their treatment plan. And the Adherence Insight Dashboard gives you just these metrics and actually also gives you a suggestion or solution on what to do to increase your adherence. And finally, patient promotions. It's very evident and clear that if you offer your patients savings, they will likely adhere more to their treatment plan. But we have suggested data to show that it actually also boosts your revenue. And I wanted to introduce patient promotions and also educate on some of the upcoming promotions that Fullscript is helping or supporting providers with. So let's get started with shareable wellness protocols. What are shareable wellness protocols? Really, this tool is an upgraded tool. We've had templates or protocols prior, but now with these shareable wellness protocols, they're meant to allow you to generate a maybe more generalized protocol. A lot of common themes would be, immune support for cold and flu, or maybe something more seasonal. The holidays are coming about, so if you do have some holiday recommendations, whether it is, some stress support or inflammation support. We all know we tend to overeat around the holidays. So if there's any support there that you wanted to put together in a protocol, and now is a great time to do that. These protocols can then become shared with your entire patient list on Fullscript. So you can choose to email it to your entire patient list. But what's more exciting is that you can also generate a link that you can add into your website as a button or into your email. So if you do blog or send newsletters, that would be great content for your newsletter. And one thing that's really exciting about these shareable wellness protocols as well is that you can share it within your colleagues, so your clinic at Fullscript. So if you have a new colleague coming on to your clinic, you can help them out by sharing some of these protocols with them directly. This is great because it allows you to build that team, allows you to build that community, and within your clinic, it also allows you to start building a standard of care. So if all of your colleagues in your clinic can contribute to your protocols, all of you can start sharing these protocols amongst your patients, and again, elevating that level of care. I do have links in all of my slide deck here because I intend to send this off to our attendees and registrants so that you can learn more about each feature or each tool. So these are the links right there. Let's go over a little bit of the benefits that we've seen from these shareable wellness protocols. So The idea behind them is that if you do create a shareable wellness protocol, it adds on to the one-to-one treatment plan that you have created for your patient, and they're meant to help increase patient engagements in between visits. So again, if your patient has already gotten their treatment for a very personal condition that they're working with you on, they could get a protocol for, again, holiday or season support, and can go ahead and purchase that. It just allows for increased engagement. Maybe they have some questions that they can send. And again, with CharmConnect, they can go ahead and use secure messaging to do that. It just increases that engagement between visits. It gives you an extra revenue boost as a provider, adding some of that revenue to your clinic and to your practice. And actually, if you couple a shareable wellness protocol with a promotion or a sale, it really just elevates that revenue boost. And I'll be sharing some of the details about that in a couple of minutes. Obviously, and that's the whole point of kind of growing your practice, you need to start streamlining your workflow, and shareable wellness protocols really allow you to do that because it takes away any of the repetitive work of the recommendation process. Over the past couple of years, especially with the pandemic, we've seen a rise in not only kind of telehealth, but also group visits or group treatment and online classes when it comes to health and wellness. And these shareable wellness protocols are great for you to be able to go ahead and do that, generate that protocol and send it in a link to the attendees of the online class or the group visit, and they can just go ahead and order their protocol straight from their Fullscript account very seamlessly.
Very nice.
Right? And believe it or not, it actually attracts new patients as well. So obviously you're always working with your one-on-one patients, but maybe you have a patient that's in your newsletter that maybe has followed you on social. Maybe their family member sees you, but they still haven't, gotten around to booking an appointment with you. They get an email about a protocol. They may as well just go ahead and order that protocol. And now you have this brand new patient ordering from your Fullscript account, and an opportunity for you to reach out and see if they want to book an appointment with you. We have a testimonial. We have Dr. Alana Romel, who is the creator of Med School for Moms and the founder of Nourish Medical Center in San Diego. When she used shareable wellness protocols recently and kind of coupled that with a 2-day sale, she saw 130 new patients or new accounts being created on her Fullscript account. So it could significantly bump up that new patient business. Again, hopefully that increases revenue and really allows you to meet those revenue goals. For your patients, it obviously increases access to wellness. They are provided with a safe and a secure place to order their supplements, top quality products, and a convenient way for them to get their supplements shipped straight to their door. This allows them to stay motivated, to stay engaged. I know for a fact that when I see a lot of our providers send out these protocols, it's always things I would love to take. It's like, oh, there's a skincare regimen, or sometimes they're really kind of fun and seasonal. And the fact that your patients will then have access to quality supplements from this content versus, going on Amazon could really help. This allows them to also, supplement their one-on-one care. And as I was mentioning before, it really helps with group visits. We have a couple of case studies from providers using shareable wellness protocols in very creative ways. So I do urge you to check those out. And a quick quote here: I love that I can create protocols that are visible to all my patients. The ability to share these protocols on my website, blogs, and social media is what is even more exciting. This allows me to reach a whole new population of potential patients and create a profitable business model of passive income for the future. Dr. David kind of says it all. This is why I love this quote from him. He really touches on all the great tools or all the great features and benefits of the shareable wellness protocols. Let's jump into adherence insights. This has been a huge focus for Fullscript over 2020 and 2021. I have two major kind of features within adherence that I want to talk about. There's the Insight Dashboard, which is a place that you can go to on your Fullscript account to understand your current adherence to your treatment plans. But also, we also have launched adherence surveys, which is a feature that you can turn on, or sometimes it's defaulted onto certain providers, that allows you to then send surveys, automatic surveys to your patients to better understand or close that communication gap, to better understand why it is that they haven't ordered yet. So it's really designed to help you better understand what's going on with your patients. The specific metrics that you'll track in this adherence insight dashboard is who are the patients who have not yet activated their Fullscript account, as in they haven't even logged in and saw that treatment plan. Who are the patients that did not order yet? And also you have outstanding refills, because as you know, with Fullscript, there are refill reminders that get sent out to patients. And if a patient has an outstanding refill, we try to communicate that to you front and center. Your Adherence Insight Dashboard is available to you and accessible on your Fullscript account under the Prescriptions tab on your account. So if you were to click on the Prescriptions tab, a drop-down menu will appear with the Insights Dashboard. And I'm showing here, any of my not ordered patients, the dated newest to oldest, and I'm trying to better understand, okay, these are the patients that have not ordered. From within the Insights Dashboard, you are able to then click on a button to send a notification or a reminder for the patient. But then also, once a survey is sent out to your patient, you are then able to click on the Show Feedback button that allows you to visit or review what your patients has said. Why is it that they did not adhere or maybe did not order? Why do you need to care about adherence? This is a huge kind of topic for us at Fullscript and even in the integrative medical space. 60% of US adults live with at least one chronic disease. So likely this disease is deteriorating with time and can only worsen with not adherence and make patients feel very hopeless. So this is where, as providers and as a community that really cares to make patients and make people feel better, we feel like adherence is one of those things that we absolutely want to tackle. 30 to 69% of hospital admissions are due to a medication non-adherence. So that could have been totally preventable if only we understood why a patient did not adhere to their wellness plan. And adherence is very complicated, right? There are very different factors on why a patient would not adhere, and a lot of it is very personal and more so personal to the patient. However, we've identified some common barriers that we can all proactively address. And as a provider, you can go ahead and do that directly with your patients as we speak today. A lot of the statistics and the copy that I'm mentioning here comes from the Fullscript's literature review that has been published in the Integrative Medicine Clinical Journal. So you can go ahead and check that out. This is one of the things that you can do to address adherence is first understand what it means in the integrative medical space. And then start looking at your Adherence Insights dashboard. It's already built into your Fullscript account. All of these tools that I'm showcasing today are free for you to use and see in your Fullscript account already. So go ahead and check out your metrics and start better understanding what they mean. And then start sending out some of these patient surveys. Some of them are automated if you've turned on the feature. And if you haven't, I can show you today how to turn that on. These surveys are very gentle surveys to patients with one question: why haven't you ordered your treatment plan yet? It's either a reminder for them to order, or it gives you insights and close that communication gap on what your patients are feeling and how you can go ahead and address that before their next visit. It really also helps you prepare for that next visit. If your patients are coming in and they haven't adhered to your wellness plan, then your plan of action should be different and should be on addressing what to do next. The last feature I want to highlight is patient promotions. These are very, very exciting ways for you not only to motivate your patients to prioritize their health, you also give a sale to your patients so they get to order some of their supplements on sale, and you end up making quite the revenue with these patient promotions. So they're limited time additional savings. You can limit it to a couple of days. You can create your own patient promotions however you want and whenever you want, but Fullscript has some built-in promotions as well that you can go ahead and opt into and select your desired discount. The reason we highlight these kind of Fullscript specific patient promotions is because then Fullscript has additional tooling and supportive campaigns to promote your sale. So once you opt into a patient promotion, Fullscript can go ahead and set up your discount on your dispensary and automatically turn it off. So if a sale, begins at midnight, you don't want to be waking up at midnight to set up that discount. Fullscript will go ahead and do that directly. We'll provide you with designed marketing materials to help you promote your sale. We will go ahead and promote your sale to your patients as well and give you or send over a very kind of carefully designed and personalized marketing toolkit. This will include anything from graphics that you can share on social media, graphics for your blog articles, for your email campaigns, so on and so forth. And in addition, on the back end, we actually increase Fullscript resourcing in our warehouses, in our stock availability, and within our customer success channels, so that all of your patients, even those that maybe don't want to log in, can call in and place an order and still make use of that sale. And finally, we then send you detailed reporting on how your promotion went and how your sale went and ways that you can improve for next year or the next promotion. If you are at all worried about, adding a savings to my patients could potentially cause my patients to not order the following month, or maybe it will dip into my revenue, we have all the metrics to prove otherwise, I should say. Practitioners or providers that have opted into the Fullscript promotions last year, we've had 2 last year, saw tremendous growth. And, these percentages are showing that most of the time you can not only double, but almost quadruple some of the business metrics here. We've seen an increase in ordering patients. That's 232% increase in the number of patients that ordered. And first orders from new patients, 112% increase. So again, this is also a way for you to attract new patients into your practice. Maybe someone who still hasn't, got the courage to book an appointment and comes to you in your office can get an email about a sale that you have and just go ahead and order some supplements that they or their families need. And we found that from within these new patients, the chances of them ordering again from your platform or from your Fullscript account, actually 73% of patients, new patients that have ordered from a sale, end up reordering again within the time period that we were studying. So that means that the new patients that come on, yes, they're attracted by the sale, but then they stay on and they still contribute to your business and your practice. And 218% increase is what we've seen from patients who have gotten their first order that year from that sale. So this really tells us that some of your patients that may have ordered through Fullscript and may have adhered at one point in time to their wellness plan have been disengaged for almost a whole year, and now is their first time ordering. So these metrics really kind of signify how tremendous the growth could be to your practice. And Dr. Gallagher said this best. She mentioned that periodic promotions and sales keep compliance levels high and remind those who may be slipping to get back on the protocol. It also helped us meet revenue goals as well. Towards the end of the year, likely a lot of you are thinking of revenue goals and thinking of, closing down or, kind of finalizing the financial year before the holidays. And this is why I do want to kind of remind everyone that we have Cyber Monday coming up. This is the upcoming Fullscript promotion. It's going to be a 3-day promotion this year. And all you need to do is opt in before this Friday, set up your discount to go ahead and benefit from this promotion. There are some tips and suggestions if you want to make your promotion even extra successful, like generating or creating a protocol and using some of the ready-made marketing toolkit that we have already created and is in place. And we'll go ahead and run your sale for you. We will email all your patients out and support you every step of the way if you were to opt in by Friday. So I just wanted to highlight that before we close off for Friday. And again, Fullscript will employ marketing strategies and use social media ads to promote the sale to your patients. So if you haven't dabbled at all with social media ads, you don't need to. These are kind of built-in ways that Fullscript can go ahead and do that on your behalf. Yeah, I have a resources slide deck here as well for you, Ranjani, and for the team and for our attendees. So I'll be sure to share that with you so that everyone can access these resources.
Awesome. Very neat. Thank you so much. It's very exciting new features within Fullscript.
Yeah.
Hala, there is one question that I see here from Dr. Amy Day.
Yeah.
Is there a way for supplement instructions, our custom instructions, not the manufacturers on each product, to be shared between members of our practice? And can those be pulled into Charm with the integration? If you'd like to.
Yeah, thanks. So there is now a way for that to pull into Charm. So we did the work to make that available, and I can connect with the Charm development team to add that into the Charm integration. So this just happened, I want to say a couple of weeks ago, where we were able to import some of these saved dosing instructions into what we call the API, so that partners like Charm can go ahead and utilize that. So Ranjani, maybe we'll make note of that. And when we meet with our, the technical team at Charm, I can go over what that means and what that could look like. But that is a new feature that we just launched. Now, whether to share the very dosing instructions with members of the clinic, I think that was the second question, it's the members of the clinic. I will have to get back to you on that, Dr. Day. I'm not sure that it exists right now.
I see there's a question that's just come in, Hala, from Brenda Dalton. If you want to take a moment to answer that.
Yeah, absolutely. Where are the products that are at Fullscript? Where are they from? So the products at Fullscript, we work with around 300 different brands. So the Fullscript platform works with the brands. We do not have Fullscript branded supplements. So we only work with high quality, professional grade brands in the industry. And also take some suggestions from providers. So if there is a specific brand that you would like to see on Fullscript, you can always kind of make that suggestion, and we can see it and be able to carry that in our warehouses. I hope that answers it. And if there are specific brands that you're looking for, Brenda, you can go ahead and type them in. And I don't know all 300 off the top of my mind, but I can certainly look that up. And of course, if you go to fullscript.com/brands, you'll see a list of the US and Canadian brands.
Hala, I see there's another question that's come up. If you want to go ahead and answer that, type
Oh,
it in.
yeah.
Yeah. And
Where to look on the Fullscript site to make sure I'm opted in for Cyber Monday? That's a very great question, Dr. Day. So on your Fullscript account, if you just go into your dispensary settings, so hover over your name at the top right-hand side, go to dispensary settings, and there is a section called patient promotions there with a widget. That's where you'll need to go to opt in. You can opt in for specifically Cyber Monday or all our future promotions.
okay, so these are some of the useful resources that I highly recommend that you all make a note of. Of course, you don't need to make a note of it. I'll be sending this to all the registrants regarding all these resources, and as well as the many resources that Hala has put together. I'll be sending a copy of her slides as well for your reference. So just wanted to close and just say thank you all for attending. This may be our last Wednesday educational webinar with respect to our partner series with our webinars, but coming up in December, we have a Tech Tuesday webinar coming up on Charm Analytics. And in January, we have some amazing webinars on charting and templates for our Tech Tuesday, as well as physician burnout coming up. So stay tuned for those and do participate. We'd love to see you there. And thank you all for joining, and have a wonderful day.